Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. This is actually a very special episode of Dadvice TV Live where we have a renal dietitian on, and she's going to take your questions. So go ahead, start typing questions you have about the kidney diet. If you're confused about food, start typing those into the comments right now so we can start building a list for her to talk about. Now, before we get to all your questions, let me quickly introduce myself. I'm James. I'm a kidney warrior. I'd like to welcome everyone out there who is new and joining us for their first time. You're going to love all the content we have. I interview industry professionals every single month, and my co-host, a renal dietitian, is here every month doing a live Q&A. So you can come here, ask questions. Don't be shy. Ask questions that you're thinking, can I do this? Is this okay? I heard about this. Should I be concerned about this? Ask the questions and we will get you the best answer right here live during the show. Now, we can't provide medical diagnosis or any treatments or answer really specific questions, but we can give lots of great information. Now, let's go ahead and let me bring in my co-host. You guys know her. You guys love her. She runs a great Facebook group, which you need to be a part of. Please welcome from plantpoweredkidneys.com, renal dietitian Jen Hernandez. Hey, Jen.
Hi, James. Hi, everybody. So happy to be back. So excited to jump into our Q&A for today. This is just something I look forward to every single month, answering your questions, providing support. And don't forget, like James said, we do have other places to support you in between these live Q&As. So really quick, if we've never met, if you don't know who I am, my name is Jen Hernandez. I am a registered dietitian, board certified in renal nutrition. I have spent the majority of my dietitian career working with people with chronic kidney disease, from early stages of CKD and learning about CKD all the way through dialysis and into transplant. And I love helping people in these different stages learn about how to protect their kidney function with a good, healthy diet that's focused on a foundation of including more plants. Because I'm sure you've probably heard somewhere that you can't eat fruits and vegetables. You have to avoid a lot of things. I heard somebody say that they have to avoid the foods that end in O, like avocado, potato, tomato. Yeah, crazy things that we hear. But just know that that's not necessarily the case, especially if you haven't had that exact discussion and understanding with your healthcare provider. And the understanding is truly key to understand why you need to have those types of restrictions if that's appropriate for you. But in the meantime, if you want to look for more information about us, you can check out our website, plantpoweredkidneys.com. Just search for us, Plant Powered Kidneys. You can find us on Facebook, on Instagram, on Pinterest, all across all different kinds of places where we provide information every day and support and free articles, free recipes and meal plans, all types of things for you at Plant Powered Kidneys.
Awesome. And I just posted on there, there are links to Jen's websites in the description. And do you want to talk about your anemia class coming up?
I should. Anemia, wait a minute. There's something
anemia
special.
is the worst part of kidney disease for me when I suffered from it. And once I got rid of it, got control of it, it was like getting my life back. So Tell others what you have coming up to help them who are suffering from anemia.
Yeah, this is something that we hear from a lot of people with chronic kidney disease, and it can happen earlier stages, although it's more prominent and more prevalent in later stages, and especially through dialysis. But I have found from a lot of conversations with people in our PPK world about these issues with low energy, feeling tired all the time, and not really knowing what to do about this. So we have created a hour-long anemia class. And this is going to be a live class, which many of you know that we don't do a lot of live trainings or live classes. This class will be live next Wednesday, the 19th at 7 p.m. Eastern. and you'll be able to jump on live with me. I'm going to be teaching this class. We're going to talk about what anemia is, the different types of anemia, what to look for in the different stages of kidney disease, how to talk to your doctor about it, and most importantly, what to do with your diet and nutrition to help prevent anemia or even improve it. I'm going to talk about supplements. We're going to talk about who should and who shouldn't be on supplements, because it's very, very important to know that just because you may be experiencing something like this doesn't mean a supplement is the answer and can actually be more harmful than good. So we're going to talk about that as well. And then all of the registrants that we have will also get a 7-day meal plan designed around a renal diet that also helps with anemia. And I'm actually going to go through it with you in the class. So you can sign up now. And I shared the link. So yeah, James just put that link in there for you. This is
in the description also.
Yes, perfect. So yeah, this is an introductory offer only for this week. So it's $27 to take the class. You'll get access to the live class. You'll get access to the recording through the end of August, and you'll get that 7-day anemia CKD meal plan that I'm going to actually walk through and talk with you about, so that you understand why I put together this meal plan the way I did. So it's not just getting this information. It's, again, truly understanding what's going on with the renal diet and anemia and how it relates to these different stages.
Perfect. All right, I've already got a few questions here. Remember, everybody, this is live. Go ahead and type in your questions. So, oh boy, I do not want to... Guys, I am bad with names, so I'm going to try not to butcher names. I do it all the time. My wife and my kids think it's hilarious. I think this is Janine. She asks, how do you calculate the amount of protein a person can have?
Yeah, that's a big question. We've talked a lot about protein in all of our Q&As and all of our shows together. So I will try to give a concrete answer, but also concise. But it's always going to have the caveat of you want to review your protein with your own healthcare team to make sure it's right for you, because something like protein is going to be based on an individual. And besides kidney disease, there's other factors that we need to consider, like our age, our activity level, the way that our body is composed. So there's different factors like that, plus any other health conditions. Like, for example, kidney disease and diabetes has a different protein range compared to just kidney disease. But I would say, and I know you put that in your question too, Janine. So, after consulting your doctor and dietitian. So the generalized range that we look at for chronic kidney disease can vary depending on the stage, severity, and again, other health conditions. Some people will benefit from the average intake, which is 0.8 grams per kilogram. That's the standard recommendation. So just sticking to the standard guidelines of protein for your body weight may be appropriate in the earlier stages of kidney disease. Maybe a little bit higher can be acceptable. And I personally, this is just from what I've experienced working with my clients with early kidney disease, they may be able to include a little bit more protein when we really focus on plant proteins. There's more flexibility there because of the way the protein is broken down and digested and absorbed by the body and the kidneys. So maybe a little bit higher. In the moderate and later stages of kidney disease, there is something that is referred to as the low protein diet, which is slightly below the standard recommendation, and it's somewhere around 0.6 grams per kilogram, but it can be even lower than that if you are in maybe stage 5 and you need something like keto analogs, which is a medical protein food specifically for people with kidney disease. With that being said, it's really important, if you do anything underneath the standard American recommendations, it's really, really important to stay in touch with your healthcare team, talking with your doctor, really getting a referral or working with a dietitian to make sure that you don't risk any malnutrition or deficiencies from cutting back too much. Because if we're not giving our body enough, that can risk other health issues to come up. So I say that very cautiously because that is what the recommendations are. And there's quite a bit of research out there related to a low protein diet and preservation of kidney function. But even all the research and the studies say, working with the dietitian, getting that one-to-one care, making sure there's no malnutrition or deficiencies present, that's a really important part of it as well. So that's kind of like my, in a nutshell, as best as possible answer. I hope that helps. We do have a few articles on plantpoweredkidneys.com about this, like the low protein diet. We have an article about keto analogs that might help you as well to learn more there. So if you want to learn more and kind of dive deeper into it, our blogs are pretty comprehensive. So they'll probably provide you with some more information.
Yeah, and I want to reinforce the working with the dietitian. As a kidney patient, the best thing I ever did was working with a dietitian. They gave me tools, education. They helped me to not be afraid of food, even going out to eat. It removed so much of the stress and the fear that I had with managing my kidney disease. And we are in control of what we eat. So when you work with a dietitian, they arm you to make the best choices, and you feel good about it, and you feel great being in control, because we've lost control of so much. We're going in, we're getting labs, we have these appointments, these medications we're taking. If you're not working with a renal dietitian, especially if you're at stage 4 or stage 5, I highly recommend get one. Even if you have to pay out of pocket, it is well worth it. All right. Georgette asked a very great question. Georgette has no protein in her urine, no diabetes, awesome. Blood pressure's under control. She wants to know, will a plant-based diet help stabilize? I'm going to use the word stabilize. She said reduced GFR, but I think she meant improve GFR.
Yeah.
So will a plant-based diet help a person who's trying to manage their kidney disease?
Well, it's always possible, and you never know until you try. Honestly, one of the things that sticks out to me in this question, Georgette says hypertension is well controlled. And that is fabulous. That is absolutely fantastic. And it sounds like you have a plan that's working for you. But I'll just let you know, and this, I feel like I need to preface this so much with disclaimers. I'm not saying stop medications at all. You need to follow medications prescribed by your prescribing physician. But I have had so many clients be able to come off of their blood pressure medications because they've made diet changes. So their blood pressure is controlled by their diet alone. They don't need to take the extra pills or medication. So if that's something that you're interested in doing, I think that could be a great option. And further controlling your blood pressure it can help your kidney, it can help protect your kidney function, possibly improve your GFR. We can never make a promise like this because, if we promised it, then we would basically be saying we've cured kidney disease. And that's not true. There is no cure for kidney disease, unfortunately, but we're here to talk about treatment options. And one of those treatment options can be making changes to your diet. So I think if it's something that you're interested in trying, and if you have a support system around you, you have people that are there to help you, you talk to your healthcare team and they're on board, and you have a dietitian to help you, you have those kind of pieces in place, it can be really, really powerful. And besides the diabetes and blood pressure or the protein in the urine, there's other factors related to our kidney health that could potentially be addressed and therefore support kidney function. Like PRAL is another one, the potential renal acid load. I just had quite a good conversation with a group of our students today about that. And it's something that I think a lot of people can forget about, or they become, overly concerned, but it's just a part of that balance. So it is a very, very good possibility that it will help, but it's just a matter of trying it and seeing what the labs tell you and what your body tells you.
Yeah, and to make sure you know, Georgette, plant-based doesn't mean vegetarian or vegan. You can still have like chicken and things like that. You're just making healthier choices, and you're pretty much starting your meal planning out with plants. And I've discovered so many things that I enjoy. I used to never eat plants. They were garnishes. They were things that went on the hamburger, or I might put them into a baked potato or something like that under all the bacon and cheese. Those to me used to be the vegetables. Now I start with the vegetables, and I've discovered so many that I like. And before anyone in there asks, I still have not tried the mushrooms. One day I will. I tried to make them and I did an awful job at it. One day when I go out to eat and there's some kind of good portobello mushroom or something on the menu, I'll order it and try it and see what it is. But I was a person who, pretty much cringed at the thought of eating vegetables. And now I love it. I love getting, a big thing of fruit, enjoying it as a snack. We have snacks all the time of broccoli and cauliflower and carrots and cucumbers. I still kind of mess up a bit on the carbs. That's my downside that I've got to work on. But just wanted to make sure plant-based does not mean giving up all meat. So it's pretty easy to try it, and there's so much research out there showing how good it is for those with kidney disease. All right, Morning Gardener Show asked, does everyone who has stage 4 end up on dialysis or getting a transplant?
No, absolutely not. I can tell you we've had so many students and clients that have come to us in stage 4 and have improved, supported their kidney function to increase their GFR up to stage 3 or have stabilized kidney function entirely. So it is very much a possibility. Again, we can never make promises or guarantees, but the last thing I want is for anybody to end up in a later situation and think about the regrets. I wish I made a change. That was something I heard all the time in dialysis. I wish I made a change. I wish I did something different. I wish I took the early stage CKD more seriously. Those kinds of things. It's just heartbreaking to hear. So that's what I want you to be thinking about, is not to have regrets of your health, of taking care of yourself, so that it's not just about the quantity of life. It's not just about living to be 100, but it's about living to our full capacity and our ability to enjoy our life, to enjoy our time with our family and our friends, to enjoy traveling and doing all the things we love doing for as long as we can.
All right, here is a great question for a dietitian. Ashley says she'd like to find healthy ways to help her dad increase his calorie intake.
That's really great, honestly. And this is something that we hear quite often at PPK, because a lot of people with chronic kidney disease get scared of so many foods, get scared of avoiding so many things, and then they end up feeling so hungry, they're not eating enough, and they just feel like they're starving, which they probably are, because they're cutting out all of these foods that they think that they have to avoid, which is not the case. But I will tell you, one of the nutrients that I think is so helpful to provide more calories and little bang for the buck big bang, little buck, whatever that phrase is. I'm losing it. But
bang for the buck.
There you go. Is healthy fats. So using like oils or avocados, nuts, seeds, things like that into the diet can be really, really helpful, because fats help us feel full, and a little bit provides a lot of calories. Just like a tablespoon of oil is like 100 calories. So you can get a bit more in there just by adding an extra drizzle to the pan when you're sauteing vegetables, or when you're tossing them to roast them, just another little splash of olive oil there, or some avocado oil. You could add some nuts or seeds into a salad, or on top of a soup as a garnish. Instead of croutons on a soup, do like a little sprinkling of pumpkin seeds. That can be really great. But these healthy fats provide a lot of nutrients, a lot of calories and energy. And many of them are very, very manageable to fit into those concerns about potassium, phosphorus, and protein. So those are the kinds of things that I love to recommend and I look at, because they can be so helpful in getting enough calories. And to also kind of revisit this in general, even with stage 4 or stage 5, just be careful that you're not, and I say you as in like the general you, not anyone in particular, but just be careful that you're not over restricting. Again, if you have a potassium restriction, for example, and you're cutting out all of these foods because of potassium, number one, do you understand why you have a potassium restriction? And number two, do you know what the game plan is around that potassium restriction if you have it? So talking with your healthcare team about that, really understanding, and keep asking why until you feel comfortable and confident in those answers. Because following a restriction, because I will tell you, even healthcare providers out there who are not dietitians, they may say, cut out potassium or stop eating potassium foods. They may say things like that, again, as a blanket statement without knowing what they're saying, because they also don't know the new guidelines and recommendations. They're not trained, they're not nutrition experts, which, they're an expert in a lot of other fields that we are not experts in. But dietitians, we are experts in food and nutrition, and that's our thing. That's what we want to do. And that's how we work with our clients. So make sure if your doctor or healthcare provider is giving you nutrition information, maybe ask for a referral to a dietitian to say, hey, you know what? If nutrition is important, then can you get me to a dietitian so I can talk with them a little bit more in depth? Because I know your time is really busy and you have a lot of people to see, but I would love to talk one-to-one with a dietitian and really learn about what is right for my nutrition. So, dietitians, we spend an hour plus with our clients each time meeting with them to go through their preferences, to go through what they do eat, what they want to eat, what they don't want to eat, looking at the labs, connecting those dots. We go into a lot of those details that other healthcare providers just don't have the time or maybe complete understanding about in those cases.
All right, here's another great question. What are your thoughts on intermittent fasting? Now, this person happens to be stage 2. Sounds like borderline, maybe even stage 3.
There's not a ton of solid research to say anything very, very solid about if it's helpful specifically for chronic kidney disease. There's some potential intermittent fasting research for things related to blood sugar control, metabolic syndrome, but chronic kidney disease, if that's the focus, intermittent fasting just isn't quite there. So if you are looking to do something like focusing on it for weight management or something, I would say it's possible to work on that. But also, if you think about, have you gone through a long fast and then after that fast, you're just like starving and you will eat anything. And then you end up overeating because you're just so hungry. This can interfere with our hunger cues. And there's this term that, if you haven't heard it, I highly recommend you look into: mindful eating, paying attention to what your body needs and eating when you're hungry and stopping when you're full. That's a whole other concept, really. There's dietitians that specialize in mindful and intuitive eating. But with intermittent fasting, it's just not something I'm fully behind yet because the research isn't there. And as a registered dietitian, I am a fan of proven dietary methods, and that one's just not there yet.
Vera asks, should we be concerned with chemicals in the plants that we eat?
Well, I would say it depends on what those chemicals are. One of the, chemicals that we could call it a chemical is a preservative. That is phosphorus. So this is not the organic phosphorus that's naturally found in a lot of foods like grains and beans and even animal meats. But the inorganic phosphorus is something that's added as a preservative to many foods. And it's not just looked at as phosphorus. It might be seen as phosphoric acid, dicalcium phosphate, monocalcium phosphate. PHOS is what we're looking at. And that is something that I'm very, very cautious with about anybody with kidney disease, because phosphorus is a long game plan. It's not necessarily something that you see in your labs as a big deal early on, but over a long period of time, it can accumulate in the blood, in the soft tissues of our body. And then in late stage kidney disease into dialysis, phosphorus can become a problem. And in many cases at that point, it's already very, very difficult to manage. And some soft tissue damage can't be reversed because the phosphorus has basically hardened the hardened the walls of the arteries or hardened some of our soft tissue. So watching for phosphorus, I think, is very, very important. Potassium additives, that's another one that for kidney disease, I don't always automatically say avoid entirely. But again, if you have a history of high potassium, if you need to watch your potassium for medication reasons or your kidney disease, things like that, looking at potassium additives and being cautious with those can help control potassium without such significant restriction of foods that naturally have potassium in them. So those would be the ones that I'd be really more hesitant about. But in general, until we see something that where there's more information to come out to say this ingredient is unsafe, and then FDA and everybody comes out and says you can no longer have this in foods, then I would be concerned. But the foods that you have out in your grocery store, even if they have different ingredients in them, and sometimes we could talk a lot about this. there's there's even the fortified foods, and you might read, like, think of a Total cereal, for example. They put a lot of vitamins and minerals in there. And if you read that ingredient list, you might not recognize everything in there, but a lot of the things that are in there are just forms of vitamins. And I know a lot of people say, oh, if you can't read it or can't pronounce it, it's not good for you. But there's forms of vitamins that you might not be able to read or pronounce, but it's just a vitamin. So be careful with getting too much into that fearing of ingredients, and look more at things that are researched and proven and shown to have an impact related to our kidney health.
Now, speaking of potassium, Hector says that he has high potassium, but he'd like to go full plant-based. Is that possible? Someone who has high potassium able to go to a plant-based diet?
I think that can absolutely be possible. And some of the things that I would recommend at first is definitely, one, keep in good communication with your healthcare team. Make sure they understand what your dietary goals are. And this, again, would be a great opportunity to ask for a referral to a dietitian who can support you in that transition and keep an eye on your labs with you, keep looking at your diet, make sure you're on the right track and getting the right amount of potassium. The other thing is you can start with the low potassium fruits and vegetables. And if you go to Plant Powered Kidneys, we have a ton of articles related to potassium. We have one about the low potassium diet, all kinds of lists there. But starting with those lower potassium foods will give you an opportunity to have more variety and more volume in the diet while keeping that potassium on the lower end. Using something like Chronometer, which is a food tracking app that we've both talked about and are big fans of, using something like that will help give you an idea of how much potassium you're consuming while you're doing this tracking, so that you actually have the data and the numbers to look at with your doctor when you're getting your labs checked, especially that higher potassium. So that's on the diet side, more like directly on the diet side. The other side is to talk with your healthcare provider about other factors that can influence your potassium that don't have to do with food. And what I mean by that are medications, because there are some medications that can impact your potassium level. If you are constipated, you might not be removing potassium through your bowel movements, and it could be staying in your body that way as well. I have found this very, very often, and that's why I still think adding more plants, even with the potassium concern in play, I think that can be really, really helpful to actually reduce your potassium. But again, be very, very careful. Talk with your healthcare provider about making these changes first so that they can track, because too high of a potassium is a life-threatening situation. Another situation where potassium could be modified in a sense, or could be higher, would be metabolic acidosis, where there could be extra potassium in the blood. And then blood sugar control. If you have diabetes, even pre-diabetes, or any issues with your blood sugars, higher blood sugars can actually change the amount of potassium in the blood too. So some of these factors, while not directly related to the potassium you eat, can also impact your potassium levels. And looking at those things and talking with your healthcare provider can help resolve that potassium so that you can get to a fully plant-based diet and enjoy more high potassium foods.
There we go. Now we're pretty much out of time, but there's one question I want to get in here from Janine, because this will help a lot of people out there. What are some tips to find dietitians that will spend time like you do and the others at Plant Powered Kidneys, spend time with the patients and get to know them? Because anyone on here who saw my very first video about my very first experience with a dietitian, it was like 10 minutes. It was in the ICU, and I did not realize that they had no time to read about me or anything. And it went awful, but it wasn't until I actually got out and got a dietitian that I learned how they actually work, which was spending time. How can others out there find a dietitian like that?
Well, once again, we have resources on our website that can help. We actually have an article. If you go to our blog and search insurance, we have an article about how to talk to your insurance provider to ask the questions to find out how much time you get with a dietitian, because different health insurance providers and plans may have certain limitations or restrictions on the amount of time you can see a dietitian. Some of them may say you can only see a dietitian 3 times per year for 30 minutes at a time. They might say something like that. So calling your healthcare provider and asking them the questions that we have listed in our article will help give you some idea. You can also go to the Kidney Foundation's dietitian directory, and you can look up dietitians in your state, and they'll have the insurances that they take, their websites, their phone numbers, email. They'll have contact information for you, so you can go that way. But I do think it's really good for you to talk to your your health insurance provider to find out what they will allow, because they're the ones, honestly, at the end of the day, for if you go through insurance, who gives the green light or not on seeing a dietitian.
All right. Well, thank you so much for your time here. Always great to get answers to these questions. I'd like to thank everyone out there for being here today. Please share the video. If you are watching this post the live recording, after now, go ahead, enter in questions. I'll see them, and they'll give us ideas for future shows that we may do. Or if we see common questions, you may get an answer from somebody else. Or I'll take note of things I see a lot of, and I'll ask Jen before the next show, hey, I'm gonna put this question in there so we can answer it, because a lot of people were asking it. All right. Thank you so much, Jen, for being here. Everybody, plantpoweredkidneys.com. The link is down below in the description, as well as the Plant Powered Kidneys Facebook group. A great resource for everyone. Even if you're not on a plant-based diet, there's so many great things in there, and it's very positive and very supportive. All right, everybody, that's the end of the show. It's the last scheduled show for the month. I might have one coming up this month. Keep an eye on the Dadvice TV Facebook page, and I'll post if there is something coming up. Otherwise, I'll see you all in the next video. Bye, everyone.